Hello everyone, good afternoon and welcome again to our live video this afternoon. I'm pleased to be back since we didn't have a video last week because I was not available, but I'm very happy to be back this week discussing a very important topic of depression. Before last week, we had quite a very interesting topic of rheumatoid arthritis, where quite a lot of our patients and followers posted many questions which we answered. And there was a great interest in arthritis, and particularly rheumatoid arthritis and gout. I like to remind our patients and our viewers that this series that we have been bringing you all since February of this year is a way of us at Freeport Medical Center bringing information and medical knowledge to our patients and all our followers, and it's one of the ways of commemorating our 10th year anniversary at Freeport Medical Center, which we celebrated in February this year. So we are continuing our educational drive to bring information to all our followers and our patients. I'm happy to see quite a lot of our patients viewing on and logging on and even sending questions and comments. As I say that, I like to remind you all that you all can post questions not only on the topic today, which is depression, but any question relevant to medicine that you may have and you may want some advice. You can post it on our Freeport Medical Center Facebook page, and we'll be happy to give you some advice. I'd also like to inform you all that we have also started a YouTube channel, Freeport Medical Center YouTube channel, and we'd like to ask you all to log in, look at our videos on YouTube channel, and please give it a thumbs up on the YouTube channel. Okay, I'd like to also thank everyone who has contributed and who has assisted at the Freeport Medical Center to make our medical center a success. We have had a great success over the 10 years. All our suppliers, our staff at the Freeport Medical Center, and particularly all and every patient who come to us and who utilize our center for medical tests, blood tests, x-rays, CT scanning services, ultrasound services, lab tests, urine tests, drug testing, fitness medical, for work, etc. We would like to thank everyone who utilize our center and to let everyone know that our center is available between the hours of 7 in the morning to 8 at night, where all of these services are available. Alright, with regards to our topic this evening, it's a very common and very interesting topic of depression. Quite a lot of times people are unaware of the importance and the prevalence of depression. In fact, it's a very common condition, and in the medical definition, if a patient is suffering from depression, it is termed major depression. So it's referred to as a disease of major depression. Depression itself is a symptom, and I'll explain it in a little while. It has been shown that it affects the work very much in terms of absenteeism and poor performance. Depression, okay? It is simply because depression can be brought about by so many different environmental factors, including work, relationships, etc. And when it does come about, it will affect your work and your performance. All right. So depression itself, the word depression, can be defined as a medical condition or condition in which a patient has a reduced mood. What is a mood? A mood is an internal feeling, the way you feel on the inside. That's your mood. All right, the way you express your mood is different. So a mood is not something that, if someone is laughing, that is the way you express your mood. That's a happy mood. If someone is sad, then that's a sad mood, as the case may be. So depression is defined as a condition where a patient has a reduced mood, causing the patient to, or affecting the patient in his or her thoughts, actions, and feelings. So if you have a depressed mood, your actions and feelings and thoughts would be affected, as well as the way your outcome in life would be affected. So that's generally depression, and it has a wide extreme of symptoms, starting from mild to severe and very severe, as the case may be. A continuum of symptoms. Okay, it's when this happens, a lot of times it causes patient to feel worthless, sometimes dejected, and unable to perform, as the case may be. So as I said, it can manifest itself in many ways. Now, in terms of the medical terminology, major depression is a medical condition now, in which, according to the DSM, which is the Diagnostic and Statistic Manual of Medical and Psychological Conditions, it has been defined as specifically, and this can only be diagnosed by a doctor, in which a patient has 5 symptoms of a list of 9. So there are 9 symptoms, and you must have 5 of those symptoms. Out of the 5, you must have a depressed mood, or you must have anhedonia. And this is anhedonia. I want to explain anhedonia because it's a very important aspect of depression. Anhedonia is a condition or feeling in which someone does not enjoy or does not have pleasure of things that normally would make people happy. Alright, so in other words, you lose pleasure of things that will normally make you happy. That is anhedonia. So if you must have either one of those for more than 2 weeks, a depressed mood or a lack of pleasure for more than 2 weeks, together with 4, or if you have those 2, then you have to get 3 of the other symptoms. And the other symptoms will include difficulty concentrating, increased appetite or decreased appetite. So some people eat more, and so some eat less. So some people lose weight, or some people put on weight. So concentrating, appetite, as we said, lack of pleasure, suicidal tendencies. So some patients may have tendencies like, for example, may have thoughts of committing suicide. It is one of the extreme symptoms, but it is listed in the list of 9. Right? Inability to sleep, or sometimes sleeping too much, so insomnia or hypersomnia. Oh gosh, I forgot symptoms. Agitation or retardation. So a patient may be agitated, or sometimes patient may be too somnolent, so people doesn't react to anything at all. Alright, so you have a list of 9 symptoms, and you must have at least 5 of those symptoms. And as I explained before, you must have one of depression or anhedonia. Right? Now, it's a very common condition. It has been said that at least 215 million people suffer from depression worldwide, and it is thought to be more common in women than men, in a ratio of 2 to 1. All right. Although it's more common in women, it has been said though that when it becomes extreme and patients tend to think of committing suicide and so on, suicidal tendencies will be more common in men, because, and it is factual, that when men attempt suicide, they are more successful than women. That's why it is more suicide tendencies will be more in men. Although women will try, but if they're not successful, men will tend to be more successful in committing suicide. All right. All right. So yes. So in terms of statistics, again, it has been said to be more common in Japan and France for some reason. I think it's because of the stressful nature in some of these countries. And yes, so yeah, and other than that, in terms of its geographic distribution, it's a very common condition throughout the world, right? Now, with regards to the cause of depression, it's such a diverse etiology that one can refer to the cause of depression as either medical, psychological, and environmental. So we would think of the medical part as a genetic in terms of your genes. So if a family, if there's a history of depression in a family, you would think that it would be more common in those offsprings. So there is a postulation. There is no exact cause in terms of no medical research proving this, but there is a postulation that there is a genetic correlation between the patients who develop depression. And then there is the psychological aspect of it, in which patients would have went through some stress sometime in their life before they develop depression. And generally it could be any time in your life. So patients could have stress as a child growing up, whether it be physical stress, sexual abuse, some kind of abuse growing up. And you could also have stress growing up in terms of general life stress. So it could be stress from, let's say, from work stress. It could be stress from family issues. It could be stress from environmental or from let me say from financial stress. So any type of stress together with those genetic tendencies can trigger off depression. Right? It has been also said in terms of stress, so you can exist throughout life. So you can have it as a teenager and also as an adult. Now there are other causes or other contributing factors, like for example, people who may have medical problems could also trigger off or could contribute to depression. For example, patients who may have had thyroid disease, which is functioning on a low level, patients who have had heart problems, cancer, etc., can trigger off these type of things. Even if you have hormonal problems like Cushing's disease, etc., can also trigger off depression. All right. There are some drugs can also, so in the category of environmental, you have the drugs that could trigger off depression. For example, heart medication, beta blockers, even psychotic drugs can trigger off depression as well too. Right, so other psychiatric drugs can trigger off depression. All right, there is also a postulation that use and overuse and abuse of drugs can cause it. For example, addictive drugs like cocaine, marijuana, alcoholism, etc., can also trigger off depression. In fact, depression also comes about when someone tries to stop the use and abuse of these things. For example, if you have abuse of drugs or addiction, you can also trigger off depression from these types of drugs, right? Okay. There is another type of depression, another cause of depression, in which we refer to as postpartum depression, where a woman after her pregnancy can also develop depression due to the stress and the hormonal changes that takes place in their body. All right. There are also depression that takes place, which you can get at the as women go through menopause. You can also develop that type of depression. Okay. All right. I'd like to say hello to Seema. I also see Sudai. Singh is on. Hello to both of you. Okay, so those are some of the causes. As I said, there is the genetic part, the environmental part, and the stress-related aspects that can cause depression. All right, we talk about medication, etc. All right. Now, when a patient develops depression, they have to go to the doctor. The doctor will do some investigations, some blood investigations, before he decides what treatment to put the patient on. Generally speaking, because it's a psychological, a psychiatric illness, usually you will not, there is no diagnostic test to say that the patient is depressed. However, the doctor makes the diagnosis based on the criteria that I explained before. However, you must do certain tests to ensure that there are no medical condition contributing to depression. So the doctor will do tests concerning the liver, kidney function tests, thyroid function, check your blood count, your calcium levels, your magnesium levels. You will check your hormonal levels, etc., to ensure that there are no contributing factors that are causing these symptoms. All right. And once a diagnosis is made, then the doctor will decide on the treatment that would be given. With regards to treating depression, there are many tablets on the market available to treat depression. However, the doctor will decide which one to use to treat the problem, because there are different extents and different tablets that use for different severities of the problem. So if the problem is very severe, use a different tablet, as the case may be. All right. With regards to the pathology, I just want to explain a little bit about the pathology, because sometimes the treatment is related to the pathology. The research have shown that the condition comes about because of a lack of a neurotransmitter. This is a little bit medical, but just to explain that is that it's a chemical in the brain that is used to transmit nerve impulses, and this neurotransmitter is known as serotonin, and there's a lack or a reduced level of serotonin and sometimes norepinephrine. So you have two neurotransmitters in the brain, which would, hello Tina, I'm seeing Tina log on. Hello Tina, she usually follows us, and she usually sends a little questions for us as well too. Yes, and so this neurotransmitter is what causes the brain to release information and cause transmission of nerve impulses in the brain. When this neurotransmitter level drops to a level which is insufficient to allow transmission of the impulses, patient becomes depressed. All right. So there are some medication, and there are some new medication on the market which allows the neurotransmitter norepinephrine and serotonin to increase level in the brain, and this will help to get over the condition. It has been said that the normal teaching is that you will treat the patient for depression, and once you treat them for at least between 4 to 6 months, and the patient gets over the episode of depression, you will also keep them on the tablet for a few months after, to ensure that there is not a relapse of the problem. All right. There are many tablets, including what we call selective serotonin receptor inhibitors, and SSRIs. You have the SNRIs. I wouldn't go into the details of the names, but these are the categories of drugs that can be used. You also have tricyclic antidepressants that we use as well too for different patients. Some can have side effects, so the doctor will decide which one that he would use. All right. Now, if a patient, this is quite important, a patient who has suicidal tendencies or have negative tendencies, you will try them on a drug called lithium. Lithium is very important for these kind of conditions because it tends to have a quick response on these patients. Remember, you don't want a patient who tends to be suicidal to be left alone and to take long to get better, because once this happens, then the patient will then have a chance of harming themselves. All right. Other than that, there's a very interesting type of treatment known as electroconvulsion therapy. Electroconvulsion therapy is only available by specialist psychiatrists, in which the level of depression is very high and is stubborn to medical treatment. So you try medical treatment and the patient is not improving. So the philosophy in this treatment is that you stimulate an epileptic fit, and it changes the electrical impulses in the brain and causes the patient to improve. This is done on a regular basis until the patient gets better, together with medical treatment, of course. So electroconvulsion therapy is where you stimulate a fit attack on the patient. Of course, it's done in a controlled environment, right? Other than that, of course, there is something called psychotherapy. It's a very, very, very successful type of treatment. I use a lot of psychotherapy. Psychotherapy is where you do insight-oriented psychotherapy. You try to get the patient to understand the problem, get them to see the problem, and then you try to get them to change some of the triggering factors, the factors that are contributing to their depression. Right? Most of the time it will be stressful related, etc., together with medical treatment. So psychotherapy is quite important, and so you have insight oriented and you have cognitive psychotherapy. A similar type of psychotherapy where again you try to enlighten the patient about the problem that is causing that is causing them to be stressed, or the environmental factors or the medical factors, as the case may be. All right. You also have behavioral therapy. This is a Freudian concept, and of course the general concept of exercise, it really helps. Patients who are depressed generally don't want to exercise, but because of lack of energy, but you generally will feel better with exercise, and the recommendation is, of course, doing at least 45 minutes a day for at least 4 or 5 days a week of cardiovascular aerobic type exercise. All right, so those are the modalities of treatment. Of course, if a patient has a medical problem contributing to it, like if you have a uncontrolled diabetes, for example, you have to control that. If you have a thyroid disease, if a patient have a cancer, all of these medical conditions have to be treated together with the depression in order for them not to have relapses, as the case may be. All right, and as I've said before, a lot of times you have to keep these patients on long-term treatment in order to prevent the problem from reoccurring. All right. So the prognosis, in terms of patients getting better with depression, as I've said before, it's a very common thing. It affects so many people. The prognosis depends on the severity of the disease. So if a patient has mild depression, the prognosis would be good. If a patient has severe, the prognosis would be poor. And if a patient has suicidal tendencies, they will have a bad prognosis. Bad prognosis means that the chance of they getting better and getting over the disease is very is low. There's a low chance of getting over, and there's always a low chance of also there's always a high chance of these patients having recurrence of the problem. All right. The peak age at which these diseases occur is usually between 30 to 40 years, and you also have another peak at about 50 to 60. So patients can cope with depression, but as they get older, between 30 to 40, you have a peak age of incidence at that age, and they can get, sometimes people get over it, and between 50 and 60 they get over as well. There are other conditions which can look similar to depression, and I would like to just yes, there are some conditions which we have to be careful about. There's a condition called bipolar disorder, which we have to be careful about, because patients will have periods of depression mixed with periods of mania. Mania means that you'll be over happy, always have a high elevated mood as opposed to a depressed mood, and you have these two alternating with one another. So mania depression, that's called bipolar disorder, or also known as manic depressive. So we have to be careful. The treatment is different, so we have to know that we don't mix them up, and again a doctor has to make that diagnosis. I do see a lot of patients who are manic depressive, and sometimes I have to do a lot of counseling and a lot of therapy, psychotherapy again, because patients have these problems and they are not aware that they can be manic depressive, or they could also have depression. All right. Other than that, you can have post-traumatic stress disorder. For example, a patient who say for example was dismissed from their job, they become depressed and they're thinking, hey, this is major depression, but in fact it has been due to you losing your job, you became depressed, and therefore that's just one example. There are other things. For example, people who went through a divorce, or who have just, you can have post-bereavement depression. You have lost a relative, a close relative, then you become depressed. So that's another diagnosis that you have to be very careful about not mixing them up. Okay. All right. I just want to go over back the 9 symptoms, because just to conclude our conversation here now about depression, and I mentioned out of the 9 major symptoms that the DSM has specified, you must have either depressed mood, or you may have the anhedonia, one out of the 2 together, or if you have both of them, and 3 others. And I mentioned insomnia, hypersomnia, agitation, poor concentration, suicidal tendencies, lack of energy, or fatigue, psychomotor retardation, and inability to concentrate. So those are the 9 symptoms, and we must those are the main symptoms of depression which the doctor will be looking for, and you must have 5 out of those 9 for 2 or more weeks. So if, in other words, if you feel depressed today, after 2 days you're better, that's not depression. That is just a depressed episode that you're going through. You have a quarrel with somebody, a close relative, and you got a depressed episode, but that's not depression. Depression must exist for at least 2 weeks. All right, so I'm seeing some Sadie's on, log on. Hello, Sadie. Right. I'd like to thank everyone for viewing. Depression is really an important topic. I like to, before we conclude our live video, I like to tell everyone that we will be putting up on our Facebook page some numbers and listing of some crisis centers who are available and who are able to assist patients who may have problems, and who numbers that you can call to get assistance. All right. So these will be going up on our Facebook. Hello, Sita is also there logging on. Evander as well too. Hi Evander. So please, I would like to tell everyone, if there are any questions on depression, I did try to be as thorough as possible. It is a long discussion. It's a lot of information on depression, and I try to be as thorough as possible. So if there are anything that you all need to know, and if any question that you have, please let me know, and we will give a response as soon as possible. Alright, I'd like to thank everyone for viewing, thank everyone who listen on our live video. We will be posting it up, so it will be on our Facebook page together with our YouTube channel, so please everyone can have a second look at it. You all can log in, and please give the thumbs up in our YouTube channel. Alright, I like to also say before I leave that if you have a problem, please see a doctor. Don't try to self-diagnose your problem. Don't try to treat yourself. See a doctor, and in some cases patients may even want a second opinion, may want to see another doctor about a problem before you go about treating the condition, or getting a second opinion, or getting a second test. Right? Please remember, depression, manic depression, patients have the depressed mood. Anhedonia, I explain about anhedonia. I see a lot of patients with anhedonia. In fact, today I was speaking to a patient about anhedonia, a patient who does not experience happiness and pleasure from things that I normally would bring about happiness in other people. Alright, so anhedonia is a very important aspect, and people need to understand that you should not be depressed about things that make you happy. Then something is obviously wrong, and you need to see a doctor about it. So I'd like to say hello again to all our Facebook fans, our followers. I know we have followers from all over, including Canada and New York, etc. Natalie, I know she looks on as well too. Bernadette is another one who looks on from Canada. So hello to everyone, and Christine sometimes looks on. I remember these names from Facebook. So hello to everyone, and bye bye, and we'll see you all next week. I think we're discussing anemia, low blood count, next week. So we'll be discussing anemia. That's another topic that a lot of people had asked us about. Again, that is a very big topic. It's difficult to complete those in 20 to 30 minutes, but I will make an attempt. Alright, so bye bye, and see you all again next week. Bye bye.